Okay, so now we're going to have a collective conversation. We've already had a head start on that. So if Joe and Ira can take their seats, and I promised Dave, and we'll finish this up at in 25 minutes or a little earlier if we run out of questions. So I promised Dave the first question here, so I'll pass that on to you.
So I thought of this question when Joe was talking about their project. So I'm old enough, have enough gray hair. I remember the early days of clinical trials when many coordinating center academics bit the dust because they couldn't find enough space to get their academic credentials in order. So my question to you is, to the extent you've been involved so far, and for anybody else for that matter, what do you see as the academic payoff for your investment of time and what you're doing and about to do? And you're not, as I understand it, you're not writing, you could, but you're not focusing on writing new papers that you generate.
Thanks, Dave. It's true. We are not writing academic original research articles using the papers. We've really used this as an opportunity to try to promote data sharing, lay out the way we think it should be done, and we've written a couple of commentaries and viewpoints about the importance of it. But it does raise the issue of, sort of, could we do this forever in this role? And, right. And to me, it almost plays the role. If we could establish, if the third party, controlled access model moves forward, I see it very much as like the model of the medical journal articles, right, where you rely on external peer reviewers, and you could certainly imagine a distributed third-party reviewer model where there's a coordinating center that gets reviews from a number of different people so that a handful aren't bearing all of the costs.
Bernie.
Could I follow up on Dave's question and Joe's response? So, having enough gray hair to have sat on more than my fair share of promotion and tenure committee meetings, do you see scientific academic value in actually studying the process of clinical trial data sharing in terms of what are the advantages and disadvantages of different models? Even in the review process, in a sense, that's a quality improvement opportunity for sort of focusing one's thinking. Is that something that would appeal to someone with the skills that you have to sort of organize this? And secondly, is this something that you think universities would value when it came to promotion and tenure, as opposed to, well, it's really a shame, he could have been a real clinical trials PI and he just took this wrong path and is just doing all the stuff which is service, which is great, but we're in hard times and we're going to have to up his clinical work by threefold.
It's a good question. It's in some ways it's a personal question to me, right?
You don't have to give a personal answer. You can give a.
I feel very fortunate. I'm productive enough. Our group is productive enough that we can divert and invest some time in work that we believe is important for society in this way. But I do think that the idea of service and credit needs to be wider spread, in the sense that you do get service for working on behalf of journals and grant committees and the like, and this opportunity to distribute data and get it made more widely available, I think, is equally, if not even more important. And the at the same time, the idea of establishing a method that allows data generators to get credit for the use of their data in the world is a critical aspect that needs to be taken care of if this is going to ever launch as an idea, because people need to be able to say, yes, I collected all this data and I was supported to do it, and I wrote 4 great papers around it, but not only that, but this data led to the 40 other papers by other investigators that I collected, and they need to get credit for that as well.
Ira?
I could maybe comment on it also. I think it's an evolving area. It's been evolving over decades in terms of the mindset of universities and academic institutions about this. Like many in the room, I've served on promotions and tenure committees and, fought those battles. But just to give you an example, when we started out in the Parkinson Study Group and the Huntington Study Group, we fought out a proposal that all of our publications on clinical trials would just say the Parkinson Study Group, and at the end it would list in the authorship who everybody was. Now, we did this before journals were accepting of this type of presentation of authorship, and it took years, sometimes decades, to kind of catch up with that. But I think that more and more academics are realizing that clinical research in general and controlled clinical trials in particular is a team sport. And as such, there's several contributions that one could make. One is as a data generator, and that's a time-honored contribution. But I think people are also realizing as data sharers and eventually as data users. So I think as we get more sophisticated about that and appreciate those types of contributions, that there will be a catch-up to that. Of course, I think the premium's still put on data generators, but I think a good data sharer is also a good data generator. I don't think they have to be compartmentalized. I think a good data user is somebody also has experience as a generator and a sharer. So I think those dimensions are being increasingly recognized. It's going to take some time to catch up, and I have some comments to make about that tomorrow too.
Okay, I have a question with a brief preface. One is, I think it probably would be helpful if we came up with a different word than rogue analyses, because I think one of the many motivations for this whole enterprise is to correct some misleading analyses that are in the published literature. So to privilege the possibility of misleading analyses from reanalysis as opposed to the sometimes misleading analyses for which data sharing is meant to correct, I think it's a very freighted term. So I think we have to be very, very careful in using that. And examples of where it has happened, and I think John made this point, and maybe a tool, where the corrective was more review as opposed to more transparency would be very, very interesting, because the assumption that if misleading analyses come from reanalysis, that's more of a problem. That the reaction to that is more control as opposed to more transparency is a hypothesis itself. And related to that, now this is sort of a left turn, but in the semi-controlled models, and this is taking off on a possibility that a tool raised. If you had submitted to you a series of proposals from some undergraduates for the data from a whole series of clinical trials, and the method sections were identical to the method sections of the published papers, would you grant them access? So you got 35. So I have a class of 35 undergraduates. I say their assignment in my clinical trials class is to reproduce the analyses in the published literature. So they submit to you the original, in a sense, the original protocols. Would those be approved in the various models that you have?
I guess I'll take this. I think it's great. It's a great experiment, because let's see if they all find the same results. I mean, the goal of asking them to submit a proposal is to lay out their pre-specified analyses and what they plan on doing. If they're all planning on doing the exact same thing, I see no reason why they shouldn't get approved and report the results at the end.
So if somebody says, all I want to do is to see what was published is reproducible exactly as they said it was, that's an okay reason by your group?
Yeah, absolutely.
I actually want to. So yes, I definitely want to hear from Jessica and Lynn as well.
Essentially, the question is whether a proposal to validate the original.
Correct.
Yes, that would be acceptable.
And would a undergraduate be considered an acceptable investigator?
The investigator team needs to have a statistician, so it doesn't mean that the undergraduate couldn't be part of that team as long as the independent external panel felt that they were capable of fulfilling what they laid out in the proposal.
But what if they'd just taken a few statistics courses and this is part of their education, and they may or may not actually be qualified? In fact, they're going to be graded on their ability to show the professor that they can or can't reproduce the published analyses.
That would be up to the independent review panel.
Thank you. Did you want to follow up on that exactly?
I'll follow up. So suppose that Steve's totally honest, and he would write in and say, I'm a professor, and one of the things I'd like to do with my class is have them replicate the results of this study. And can you release the data set so that all my students can do this analysis to see whether they can replicate it or not? So it's, rather than having all 35 students apply, he is applying on their behalf. Is this something that would pass your muster?
So it sounds very interesting, and it sounds like a proposal that should definitely go to the external panel to decide.
Okay, Ira?
We've actually had such a request, actually very recently. We had to actually turn them down because the data set we had, which we didn't discuss in great detail, had genetic and hereditary information that was the basis of doing this. And without getting into all the details, I still think there's a problem with potential identification from that. We know many examples. So I'd say what we decided to do is release the data and censor all the genetic and the hereditary information, which in the case of this was a Huntington's disease project, really restricted a great deal the information on it. But as an exercise, we permitted them to do that with that censored data set.
Jessica, how would a request like that be received by I'm sorry. Lori, you had your.
Okay.
I was looking at the wrong name tags. I apologize.
Yeah, no, that actually would fly with the ADNI model, absolutely. And we've had a number of undergraduates actually apply and use ADNI for ADNI data. So yeah, that would fly.
And how did you adjudicate whether they were quote unquote qualified to do the analysis?
Well, really, what they're looking at is what is their plan. So you have to submit what you're planning to do, and that's why I said very few are actually rejected. It's only a handful. Well, maybe 70, as I think I pointed out, were actually rejected because they seem to be nonsensical. They didn't seem to be students. They didn't seem to be teachers. So we've had a lot of teachers and a lot of students themselves actually looking at data.
Thanks. John.
So just to point out, this is one of the reasons why open systems, actual open systems, ones that pass the definitions of openness, tend to scale better than permission-based systems, which is the number of potential uses for data is so much higher than the number of uses that were designed into the system when they were created. And it's the difference between sort of all of these moons are yours except Europa, which scales, and you can only go to this one part of the moon, right? So what you have, right, in every single system on the internet, the more clicks someone has to make, the less you get users, the less users you get. And so it's really important to name these things correctly, because the people who buy into open source and open culture and all of these things are going to show up and hit these walls and go nuts, because they can't assign them to their class, because they can't take the data set from one group and combine it with the data set from another group. And so these are all wonderful systems. I'm not beating up on the systems, but what we're recapitulating is the ISP market of the late 1980s, in which you could not send email from Prodigy to AOL, right? And that is the data equivalent of having lots and lots of these silos, is you can't do the recombinant work. And so that's why it's important to label them correctly. And so, generally speaking, if you have to have a credential to get approved, it's not an open system. It may be acceptable that you have to sign something that makes you a qualified user. Right? That may or may not, depending on what the qualified user agreement requirement is, qualify as open. And so it's not a pejorative to say something is not open, but it's really important to not trigger, sort of through appropriation of something that the community has fought long and hard over, the phrase. Because when someone shows up who's used to free software where you have freedom, to free culture where you have freedom and rights to recombine, to reuse, to redistribute, and that you're never asked for a credential, it's important to respect that, because otherwise you can either have the support of that community or you can have the ire of that community. And misusing the labels is a very good way to trigger the latter.
Can I just add a comment to that as well? I think you can keep pushing the boundaries, Steve. You can be happy with their answers with college students, and then I can just ask whether high school students will have access, like Jack Andraka with his pancreatic cancer diagnostic and Brittany Wenger with her breast cancer diagnostic. So you can keep pushing this down. I think the issue is, I do find it interesting that it sounds like dozens, if not 100 people, perhaps have gone through the trouble to ask for the data and still are not treated as being legitimate. I'm kind of curious who would go through all that trouble and not be viewed as legitimate.
So one other comment to your question. If the professor is a qualified statistician and is overseeing, I mean, it seems to me that validating the results, which is one of the assignments to the class, and a publication plan, I mean, that could fit within the realm of what's envisioned by the model. But the difference between the data generator controlled access, individual controlled access versus the multi-sponsor controlled access is significant there because of the enhancing public trust through that review process.
Yeah, I'll just note that some of the issues here are not so dissimilar than what have already occurred with meta-analysis, which was at the beginning regarded as sort of tedious librarian's work, then was seen as real science, and then it is reuse. And I've had classes that publish the reanalyses they do as part of the class assignments, but they don't have to get permission, obviously, to use the data. Tim.
So I want to just probe a little on ROI. So we've had sort of a range of the models. I mean, 15% of 100 million, you start scaling that out, that comes to significant investment of resources, public resources in many cases, and you can see the tension between investigator-initiated research and curation. And so at which point do we say enough and it's just not worth it? So I'd be interested in the reaction of the panel to at which point do we say it's just too much and it's just not worth the investment?
I can't argue, dispute the numbers already given, but I think it's important to understand capital costs versus marginal costs. If such a system were built with X amount of dollars, what would be the marginal cost for any new trial data going into such a system? I think what you're hearing right now are one-off capital costs because we don't have such global systems.
And yet to follow on to that, this is another reason where the ability to copy and redistribute cuts the net cost because the people who value the data set have the right to store and preserve it, as opposed to the people who generated the data set who might no longer value it if they no longer have the exclusive right to mine it. Right? One of the rules in free software is that so if you don't have anyone contributing to your project, you don't have a free software project. And so if you don't have people who care enough about your data set to mirror a copy of it or to pay for an Amazon instance that mirrors a copy of it, then at some point the choice will be made to cut the data, which may turn out to be really valuable later. So there's all these positive externalities that you get in terms of distribution. In libraries, it's called lots of copies keeps stuff safe, or locks. It's a pretty central thesis of library archiving of the literature, which is that the more copies you have of a thing, the more stable your preservation strategy is, and the less centralized you need the funding to be. But it's at odds with this sort of, proliferation of controlled systems model. And that's a natural evolution to go through. But in the end, if you're going to have to decide at some point, I got to keep dataset A versus dataset B because I got to pay for the servers, you're going to make different choices than the community might make.
Ira.
Just to try, I don't think we have enough data to answer that question. I think that what we need to do is have prospectively derived data on costs and a variety of costs. The 15% estimate that we put out was on the basis of interviewing the key people and the investment that ADNI, a non-randomized clinical trial, made over a period of, 12 years. And that's with foresight. And that they knew that they were going to share right from the beginning. So I don't think we have the answer to that, and I think that's one of the problems with data sharing is where there's a dearth of data about it. So I think one thing that would be very useful is to collect prospectively actually these costs going forward, and to be able to compare them against the various models. Now, one would have a hypothesis that open data sharing would be the least expensive, and the more closed the system, the more expensive it would be in a way. But I think only by doing that can we actually learn what the actual costs are. And also, we might find some innovative approaches in terms of collecting these data that would prove to be efficient and cost-saving.
One more quick response to that. For interventional trials, many of them do go through contract research organizations, which typically do organize much of the data so that can be analyzed and then reported. And so I might argue perhaps 90% of the work that we're talking about might already be done by a CRO for some multi-center trials. And it's a marginal amount of work then to release it.
Bernie?
I had a response.
Oh, I'm sorry.
Sorry. I think this is also one of the risks for the multi-sponsor model. If there aren't enough sponsors on that framework, that approach, then the convenience, ease of use by the requesters is not realized to the degree it could be. And I think the return on investment, the use of that system might not be as good as we'd like. Although the increasing public trust and other benefits may still be realized.
Was there another one?
John,
You made your comment, right?
Oh, sorry.
Yeah, okay.
Could I ask the panelists to just really quickly talk about the question of getting a hold of data, shared data, in order to do hypothesis-generating exploratory work where there is no pre-specified hypothesis, but it may lead to, a brilliant insight, or it may just be recreation. Your thoughts on that?
So that's one of the goals of GSK and this initiative that this journey we've been on, generating new hypotheses and advancing science, has been one of the, and including validating our results. Those have been high priorities. Still, though, it's not a fishing expedition. It is, a submission of a proposal which can still be used to generate hypotheses.
Specific would I need to be about the methods when what I'll do may vary depending on sort of the first cut of analyses I do. And suppose I swear in blood that I'm not going to publish it I'm just generating new ideas. I'm not going to sort of put it up on the web or publish it. I mean, I'm just trying to get at the balance between not being able to specify because it will be dependent on what the first analyses are.
So I think this is an important point. We do have a requirement for a publication plan, and so a specific proposal is necessary. So that wouldn't be consistent with, this model.
Atul, did you want to add to that? It was going back and forth.
I can't figure out which button to press. I don't need to add much more. I think but I just want to caution, there is a continuum between hypothesis-free and perhaps hypothesis-rich, where you have a hypothesis that something is affecting the care of these patients, the outcome of these patients, but you're not sure which of these factors. So you can go in comparative effectiveness study. So there's middle ground in there.
I mean, I would like it to be the case that someone who is a bored data scientist at a hedge fund or at Google who's tired of selling sweaters or optimizing transactions could download this data in their spare time to a secure Amazon cloud instance and just run models. I've been lucky to work around a tool for a long time, and he said something to me, I think in 2003, which is that if you have enough data, noise doesn't converge, right? Hypotheses start to converge. And I view fishing expeditions as a positive benefit of data sharing. In particular, if you can combine enough of the data sets and just see what pops out. Because what pops out may be completely insane and not biologically relevant. It may be just an overfitting of the model. But if it's a 1 in a million shot, right, we need to have 1 million people shooting. And so that's the feature of sharing. That is the signal argument to me of sharing the data, is to make the cost of the fishing expedition so cheap that we don't have to get into a fight over whether or not to allow it. That it's an externality of the system that fishing is something that can happen. Because there's a lot of really smart data scientists who have nothing to do with this space who are really bored. Right? They are really tired of making you click on sweater ads. They are really tired of optimizing hedge fund things, and they would really like to cure cancer. They come to me, they come to our organization, they come to people like Atul. And right now, we don't really have a place for them because they don't do science the way that the culture thinks about science. And finding a way to balance access for those people with the realities of the obligations we have to participants and to PIs and to the companies that have generated the data that's the challenge.
recommending that Google execs steal our jobs. But
I think they might find it a little harder than what they think it would be.
Anyway, I think we're going to have to break. But thanks to the panel for the great discussion.
Absolutely. Let me again thank the panel. Let's take a break, 15-minute break, come back at 20 of 4.